The title for the next panel is Medical Guidelines for Examiners and Suitability of Ayush Doctors, for which I invite on stage our esteemed panelists, Dr. Vijay Belani, Founder and Medical Director, Dr. Belani's Blue Shield Medical Clinic, Dr. Divakar Tiwari, Medical Director and Partner, Globus Medicare, Dr. Kiran Pandit, Consultant, Guru Kripa Hospital, Thane, Captain Dr. Shashank Jahagirdar, Managing Director, Country Head, MTM Ship Management Private Limited, Captain Mohan Nayak, Managing Director, Dynacom Tankers Management Private Limited, Captain Nitin Mukesh, Deputy Nautical Advisor cum Senior DDG, I also invite on stage the moderator for this panel, Captain S.M. Halbe, CEO, Maritime Association of Ship Owners, Ship Managers and Agents, MASA.
Thank you. It's not often that I come on stage and there is music playing, but we will wait for the music to end. The panel has been introduced. We have some very esteemed personnel on this panel, and though there is a Dr. Jagirdar, but he's from the maritime field and he's not a doctor. So kindly speak on the maritime side. Yes. Thank you. This afternoon watch is always a bit of a challenging watch. You know, people are well fed. People like me have had 3 helpings of dessert, so I am not coming for any PEME postprandial, I know the outcome. And I also must compliment the far-sightedness of the DG Shipping and Marex Media to call this a conclave. We are having a conclave here, and there is going to be another conclave on 7th of May where the outcome is being looked at by the whole world because we will get a new pope. So the conclave is a very important thing and there should be a lot of takeaways from this conclave, and I don't wish to sound frivolous. So without much ado, Doctor, what we will do is, we have a task of talking about the medical guidelines for examiners and suitability of Ayush doctors. So we will do it a little differently on this panel. All the speakers will get a couple of minutes to state their point on this topic which has been given to us. And the order of speaking, if I may, is Dr. Pandit first, followed by Dr. Shashank, followed by Dr. Tiwari, followed by Captain Nitin Mukesh, then Captain Mohan Naik, and Dr. Belani, since you had the opening slot, so you get the last slot here. We have to be fair. Yeah? So, over to you, Dr. Pandit. And by the way, Dr. Pandit is a Ayush doctor.
Yeah, thank you, sir. Very warm good afternoon, everyone. Respected dignitaries on the dais and in the auditorium. The topic that I am going to talk today is about suitability of Ayush doctors. I mean, the word has been very important, suitability, whether we are suitable. When we talk about suitability, we look at a couple of aspects which are important, which make us suitable. The first is, are we constitutionally right to become medical examiners? Second, are we clinically competent, or do we have the adequate knowledge to become medical examiners and certify seafarers? The third point will be, are we able to interpret the medical or the diagnostic jargon that seafarers have to undergo during the medical examinations? And finally, we really come to, does the maritime industry really require Ayush, whether it is today or tomorrow? When I talk about the constitutional right there are multiple acts which basically govern us as clinicians and practitioners. For the allopathic doctors who are present here, they have the National Medical Commission. For Ayush doctors, Ayurveda and Unani doctors that I represent, and homeopathy, we have the National Commission for Indian System of Medicine, that is NCISM, and we also have a council called as National Council of Homeopathy. These are three very, very important national council on par with each other, who are basically have the mandate of developing curriculum, ensuring that the curriculum is taught properly across medical colleges in India, and ensuring that the quality of doctors who pass out through these medical college have the equal amount of competence when they deliver the clinical services. So there are a lot of constitutional, right from the Clinical Establishment Act to the NCISM Act 2020, which has been passed by the Parliament. There is also a regulation, NCISM regulation of board and ethics of 2023, which has been vetted by the Parliament, which gives us the Ayush doctors a right to practice modern medicine to the extent of training and teaching that we have received in our undergraduate courses. When we come to the undergraduate courses, there's a question mark in many of the online meetings that we had, where panelists debated whether Ayush doctors are able to understand a ECG, are able to take a blood pressure. I mean, these sort of ignorant questions were asked by a few panelists. But let me tell you that we also come from the same national test that all the MBBS graduates come from. So there's a 4.5 years of theory, 1 year of internship, and we also have a lot of standard treatment guidelines developed by Ministry of Ayush. We also adhere to the standard treatment workflows which have been given by the Ministry of Health and Family Welfare and jointly by SEMR. So there are a lot of things that Ayush doctors are able to do based on the education, the curriculum and the competence that we have. So I think these statutory, we are very, very competent, and we have a lot of acts which give us the right to certify physicians and the seafarers. Basically, Clinical Establishment Act, NCISM Act, the Birth and Death Act. There are a lot of acts which basically give us the right to certify the individual based on that. And finally, do we really need Ayush in the maritime sector? I think the recent notice 4 of 2015 put up a couple of days ago on the DG website, which talks about the grievance redressal committee which has been formed, basically to tackle the aspects of ill treatment, the hazards that our young seafarers are facing on board various international flags. Talks about reinforcing Sagar Mein Yog and Sagar Mein Samman. This has been put explicitly on the notice 4 of 2015, and I think Ayush plays a very, very important role when it is preventive healthcare, curative healthcare, and when we also talk about mental health care, that we are equally concerned with the seafarers. So I think considering all these facts, when we talk about suitability of Ayush practitioners, I feel that all the Ayush practitioners present here and those who are providing services across India are equally suitable to become medical examiners. And finally, I would like to state that this point of Ayush doctors came into effect since 2015, the notice 1 of 2015, wherein it was said that considering the large number of seafarers who are employed or engaged on Indian and foreign flags, it is necessary to have more number of medical examiners. Way back in 2014, we had, sir, close to around 200 odd medical examiners, 204 to be precise, and with 96,000 seafarers across India way back 2014. Come back to 2025, we have close to 5 lakh seafarers and just around 600 medical examiners. And out of those 600, we have close to 150. So when we are talking about having a burden of a number of seafarers are increasing in clinics, whether we are debating on where a clinic should have 2 or more than 2 medical examiners, and my seafarer should not be able to travel or should not be made to travel across kilometers to do a medical examination, it becomes pertinent that we have medical examiners of all medical sciences, recognized systems of medicine that Clinical Establishment Act calls us, whether it is Ayurveda, homeopathy, Unani or modern medicine. All these are known established clinical methods. So I think so we can have doctors across all the pathies who can do. related to the competence, I think the refresher course and the course familiarization course would be important, which will be able to give that. Thank you, sir. Thank you.
Thank you, doctor. But there is one underlying fact that the choice of the doctor remains with the companies,
Sure,
the employers.
sure. And I hope that the companies will be inclusive to understand that let's not be discriminative or, yeah.
The companies here are also governed by their clients' requirements and not only their own. So we have to
Yes,
play
sir.
the game carefully on that one. Dr. Shashank, please.
Yes, good afternoon everyone. Congratulations DG Shipping and Marex for conducting this session. So the topic today is for this panel is basically the medical guidelines for examiners and suitability of Ayush doctors. So, coming from industry, as a ship owner or ship manager, whenever there is anyone who medically sign off, basically it hurts a company. The reason is not because this is not budgeted or this is not accounted for. So every medical sign off, when it happens, there is a cost. Whether it is borne by company or P&I club, that's different. But end of the day, it is ship owner who face the heat. So definitely when it comes to medical guidelines for practitioners, lot of times I'm sure the doctors here you must be getting you see the seafarer coming and sometime during the examination you see that probably he's a borderline case, whether it is we are talking about the urine stone or this thing, and then the question there is a dialogue happens between the doctor and the company that can we certify him, yes or not, because there is a risk when we do that. And I think it will be good. I'm happy that DG Shipping is coming out with some guidelines, new circular. So those things will probably will help to clarify all those things. Coming to suitability of Ayush doctor, as Captain Halbe rightly said. So it will be really interesting, to see how it goes, because to be honest, in the industry is not. I mean, we are used to seeing the doctors, practitioners, how it is today. When it happens, the suitability of Ayush doctors, that will be, there will be a good discussion. Of course, as a customers or clients, we need to check with our principals, owners, when the time comes. But I'm looking forward to this discussion. Thank you.
Thank you, Dr. Shashank. You did mention about repatriation, and even in the earlier panel there was a talk about repatriation and expenses. I have here some statistics published by the Health Economic Review, cost of repatriating an ill seafarer. Just some sample. Acute myocardial infarct, 98,823 euro. Malignant hypertension, 47,000 euro. Appendicitis, 58,000 euro. Malaria, 24,000 euro. So we are talking big bucks here. So we have to take that into account, and irrespective of the fact that whether you had any hand in it or not, but when your seafarer gets repatriated, there are guns being pointed at you from in your client's office. Whatever the policy might be, that's a fact. Yeah,
Exactly.
So, sir, we will talk more about this.
Yeah. So just to share with you, when I have visited Philippines couple of times, this problem is more serious in Philippines, because there, the seafarers claiming disability is quite high after they sign off. And that is where P&I are very, very particular. There are more discussions happening, P&I and doctors, about the strictness of the medical
Yeah, true. Can we go to Dr. Tiwari? Dr. Tiwari has experience of being on board as well, apart from being a partner with Globus Medicare, right? Yeah. Medicare. Yes, Dr. Tiwari.
Thank you, everyone. Thank you for having me in such an esteemed, in the middle of such an esteemed panel. It's an honor to be sitting here. I will be highlighting a few points on guidelines for medical examination. It's a very vast topic, so I'll be just picking 3 points up. Captain Azad sir, when he was addressing in the morning, he did say that we have to be in sync with the international guidelines when we, decide what we want to incorporate in DG shipping draft of 2025. So there are three things that we came across that should be, corrected. Number one, from page 49 to 63 on the draft 2025, there is something called as decision regarding medical conditions and what should be considered as unfit. Now there is a little, it is not done in a very good manner. What we can instead do, we have ILO guidelines 2013 Geneva, which is used worldwide. We can use the Appendix E from there, which has all the medical conditions in tabulated form and the decision-making process. It gives you a guidance how to go about every case. So we can straight away put that Appendix E reference into our draft rather than we were ourselves working on to the, every medical condition and deciding what to be done. Rather, it is already done and the world is already following it. So we have to just come in line with that. The other thing that I wanted to discuss is why also is this important? In our draft, which has been, being carried forward from 2000, there is a mention of blood pressure reading saying 150/90 is acceptable, for a certain age 175/100 acceptable. Now, this is not in line with current guidelines, international guidelines. And having this thing in black and white in a government's document might be detrimental to everyone. So we should actually get rid of those lines. The other thing is hearing aid. Our guideline says hearing aids not allowed, whereas international guidelines does mention hearing aid is allowed in serving seafarers. And how is it allowed? They have also given a brief of that. So we can actually incorporate that as well so that we are in sync with the international guideline. The other thing is, this is my last topic, eyesight standards for pre-sea medical examination. Now, 1997, the medical guidelines which was given by WHO, IMO, had terminologies as pre-sea and seafarer medical examination. These were two. In 2013, they said this new guideline will supersede all the previous ones and they removed the word pre-sea. Now it is only seafarers medical examination guidelines. By doing that, what we will achieve is the eyesight standard for pre-sea mentions in our guidelines in DG shipping notice that spectacles are not allowed for someone applying for a course or going to a college. So this is not being done anywhere in the world. We are the only country who is doing it. By doing this, what is the harm? The harm is that we are subjecting lot of our cadets, young seafarers, to undergo LASIK surgery or eye correction surgery. So what's the harm in doing LASIK? Many would ask. LASIK, even after perfect correction, predisposes one to substantial diurnal fluctuation in vision, meaning दिन में बहुत अच्छा दिखेगा, शाम को उसका vision शायद 6/60 भी हो सकता है. So no one checks that. All we check when the seafarer comes in the daytime, we check his vision, LASIK done, corrected, 6/6, go. But then this person, because he has undergone LASIK surgery, he has a risk of diurnal fluctuation of vision. This is documented in black and white in lot of P&I club handbooks. All we have to do is we also pay attention to that and remove the mandate of not allowing spectacles to a seafarer, a new seafarer. So we are looking at a risk. What happens in emergency evacuation if he loses his spectacles? Then there is a minimum requirement. We allow specs, but without specs, it should be at least 6/60. This is accepted in UK, in Europe, in Philippines, worldwide. We are the only country who are doing this, and I'm pretty young to this. I don't know where it started, but this is something that we have to, bring in line with the world's guidelines. Thank you so much.
Thank you, doctor. You did mention about the ILO guidelines being revised, and there was a table, or there was a table there. Yeah. India had that table, if I remember correctly, and then they replaced it. Dr. Matthew, am I right? Because there was a table earlier which categorically stated the conditions on which fitness could not be given. There was a table which was withdrawn and a new one has been issued. This was more than 10, 12 years back. It was there. If I dig deeper, I will find it. It is there, or was there. It's not anymore. Over to you, Captain Nitin Mukesh.
Thank you, sir, and good afternoon to all. I'll not discuss the what is the examination, some medical examination of seafarer, because already in the presentation I have shown that what all things we are proposing, and I will request Dr. Tiwari to send your suggestion, whatever you discussed here, so that we can incorporate if it deems fit by the technical committee and the members of INSA, MASA and all. So now I come to that the burning question, that suitability of Ayush. That is a very burning question. That lot of meeting I took, and a lot of that there was 150 doctors they were present, and there was lot of fight. The MBBS doctors were saying something, and the Ayush doctor was also saying something. So it was very difficult to manage and very difficult to know that who is correct and who is not correct. Then we decided that we'll call the Ayush doctor one by one, BHMS, then homeopathic and other people. So they came and they have submitted all the syllabus and everything, which whatever we have asked, and only the two Ayush doctor they have come, homeopathic and Ayurveda, and other Ayush they have not come to the directorate for their submission that they should be included in the medical rules or not.
Approved doctors.
Approved doctors or not. Only two doctors. So if anybody from other Ayush are there, so they are invited. They should come and they should submit their syllabus and everything. And we are very open. We are very open. We will wait for the legal advice. And if it is feasible, definitely we are going to take it. But it depends on the legal also and the stakeholder, technical committee and other requirements. So Ayush doctors should not think that we have taken them out and we will not take it inside. But they have to prove that they are at par with MBBS and they are going to perform a very good service to the seafarer as well as to the stakeholders, and in the directorate we are very open, and others Ayush also should come and they should submit their documents. So the suitability of Ayush doctor, suitability, this very burning question, suitability. So this it will be decided that Ayush to be included or not. It is still in the back burner, but definitely we are very open. You should I should assure on behalf of director, we are very open that we are not going to take you out. But depends on the market also, depends on lot of things, legal implications, you know.
Yeah.
So on that, sure. Thank you very much.
Thank you, Captain Mukesh, for your assurance to treat the situation fairly but firmly, because at the end of the day we will need an outcome also, which can go either way. We don't know that. May I request Captain Mohan Naik to, I think there's a mic there.
Good afternoon, ladies and gentlemen. First of all, thank you, Marex and DG Shipping, for inviting me to be a panelist at this very important conclave on medical examiners, rules coming up, as well as this panel for inclusion of Ayush doctors. A lot has been already said about physical fitness guidelines. I would like to dwell upon a little bit on mental fitness at the beginning of the career as well as during various starting of tours of duty. What we have found is there is no standard per se medical requirements for entry level. There are some tests called PF16, as my friend Dr. Deepthi will talk about later on. This is not a very reliable test. It has got a few questions which anybody who has already been, has previewed this particular test can easily pass it. Also, there are lingual problems. Somebody who is coming from the hinterland, he has a problem with the language, with English, especially the ratings, they have a problem. So what we have found from my company, I'm not trying to say that we are doing the best, but we do have ships which are going into the polar regions where a lot of hardships are to be faced by the seafarers, and we found some tests which are very, very good, something called a CDS test and something called a MCMI test, MCMI3 test. Cognitive difficulty test, that is a scale which measures, and MCMI is something called a million test. It starts with million, consultative, some X-yoke form test. And the third version is there, which is a very good test, and so far we have not had any failures of even the new beginners going on these very difficult ships to perform on, as well as in the beginning of the tour of the duty if they pass this test. Secondly, I would like to also talk about certain standardization in the physical tests. For example, we have a problem with seafarers not declaring their existing preconditions, which has already been talked about in the morning. I'm not going to do anything more on that. Secondly, kidney stones. Kidney stone sizes are a matter of discussion. The urologist does not recommend removal of the stone depending on its size, but at the PME, it is a red flag. So it is difficult for the company to analyze whether to send this person or not. And doctor sometimes says, it's your call. You want to send him, you send him. I will declare him whatever you want to. But this is again a very gray area. I know one of my doctors is smiling there behind. The third thing is BMI. Accurate BMI should include muscle mass and bone density calculation. But at the clinics, it is only calculated basically. So we are also in a very gray area whether to, which BMI to pass, because the guy who's tough wrestler, bodybuilder, he has a high BMI, height is good, and he can go inside the tanks and come out. But it's very difficult to, just say that you're unfit. Thirdly, there is a thing about the stent. It is not very clear. One doctor says, "Arey, ek stent hai, chalega, he can go on board." But you declare him fit for only 1 year. Other doctor said, no, I'm not going to declare him fit at all. He is unfit because MLC says so. Now, MLC clause on stent is very, very unclear. We are not sure. So I don't take him, another company takes him. So I think the DG shipping can, try to find out whether stenting actually is jeopardizing his service at sea, or do we only give him a service on the, near coastal region or something like that. So these are some areas which I would like to highlight. And from me, that's for the moment. Thank you.
Thank you, Captain Naik, for sharing some practical issues. Because this matter of kidney/gallbladder stone, they're different, but it's still a stone. I have a personal experience that my company at that time, we were not doing sonography. It was not common to do sonography. But we had 2 incidents in 6 months' time. One involved a helicopter evacuation, and one a diversion of a vessel to land the patient, because the pain is excruciating. You cannot, it's just unbearable. And the funny part, I'm using the word funny, both were okay. The person who was taken off by helicopter joined back the ship after 3 days once the stone was flushed out. He was hale and hearty, And we had a hard time trying to explain to DG Shipping, because we reported that the helicopter evacuation has taken place, being a medical condition. And then we said, no, we want to sign him back on. So we had to explain, how can that happen? So, okay, nothing happened finally. The person was back on board. But then we made it a practice, because the cost involved was so much that every seafarer underwent a sonography once a year, as was there. So we will move on to the last man on our panel, none other than Dr. Belani.
Thank you, Captain Halbe, and thank you, Marex, Directorate. Good afternoon, everybody. First of all, I'll address some questions raised by Captain Naik. Psychometric evaluation. We've had candidates who have filled up the questionnaire in an auto. somebody has done it while watching TV, so definitely the assessment will not be realistic. Secondly, if there's somebody who has a psychiatric problem and is in remission or on treatment, his test will probably return as normal. So there are no objective tests that would always give you the correct answers to psychometric assessment. Next is renal stones, kidney stones. The guidelines are very clear. Some of my colleagues say 2 mm, 4 mm. Captain Naik says, one person, doctor saying, as you say, we will do it for 2 mm, 3 mm. Guidelines are very clear. The seafarer has to be stone free. As Captain Halbe said, helicopter evacuation. We have had cases where crew members are rolling in pain on board a ship with kidney stone. And unfortunately, none of the top senior ranks are willing to give IV injection, intravenous injection. It takes just 2-3 minutes to relieve the pain, and perhaps a day, 24 hours after the ureter is dilated to flush out the stone. So it's very clear currently, and I don't think there's any doubt. And of course, every day we have this issue. It's only 3 mm, it's lower pole, it's not upper pole. Guidelines are absolutely clear. If I'm wrong, I would like to be corrected, but they're very clear, both in MS rules and ILO guidelines. There is no variance at all. Regarding these cardiovascular conditions, we have submitted to the directorate that is very unfair to summarily dismiss somebody unfit who's had a PTCA, angioplasty. Somebody who's had an angioplasty has undergone an angiography. Perhaps he's better than I am. His arteries are better known in the heart than mine. And if a stent has been placed, there is no reason to abruptly end his career at sea. So one could evaluate after a particular period of time if the seafarer meets the standards of whatever standards we set up, he or she should be able to make it back on board. Same is for a bypass surgery. Wait for a certain period of time, maybe 6 months, re-evaluate, because cardiovascular diseases are on the rise with our lifestyle changes, with our food, with our genetics. So we need to take a holistic view, and this may not align with international guidelines. Demographics are different. Filipinos have a different guideline by P&I. Ukrainians have different, Indians have different. So can we in India do this. And lastly, regarding suitability of Ayush for as DG approved doctors, I would say the international community, the P&I clubs, and the international maritime community is looking at if a doctor is approved by the local competent authority, they have no objection. And we doctors, as DG approved doctors, we are facilitators and not curers. We are facilitating only a fitness of a seafarer based on the tests, and we should look at it holistically. And as Captain Mukesh said, there's evidence both for and against, and the legal cell technical committee will look into it and come to a conclusion. Thank you.
Thank you, Dr. Belani. On a lighter note, I would not trust any seafarer to administer IV to me. Not a chance. Okay? That's a reality. And I don't know how many people here will volunteer.
But that's the best chance you have to be relieved of pain.
Wait for a helicopter.
You may be out of range for a helicopter.
Of course. There is one you mentioned about angioplasty and heart surgery, etc., bypass, etc. Isn't it that it will get correlated also with the doctor's own experience or with such incident? You see, if a particular doctor, DG approved doctor, has had, say, 10 such cases in the past 5 years or something like that, and the outcome has not necessarily been very good. You know, when he went on board after, say, 6 months observation, then he got off because of some other ailment or some other problem. Isn't it that the doctor is going to then be inclined to say avoid him? Is it not going to be?
Personal emotions do play in every doctor's
Will
decision.
play, should.
Those doctors who are not doing joint replacements will not replace a joint replacement. Leave aside the DG approved doctors. But there's a trend. We can do the trend analysis. And as we see what in the past, when before 2013, we did send out people with angioplasty or bypass, there were no such adverse incidences which were more than the usual population. So I would feel it is all right to reconsider that condition.
Thank you.
May I add on this topic?
Yeah, please do. Please do.
This is a very, burning topic. It has been time and again raised by various companies, whether to allow a person with stent on board or not. As I totally agree with Bilani sir, and we definitely can consider sending someone who has got stent after doing a proper cardiac assessment. By cardiac assessment, I would like to highlight here in front of so many people that we are attending. Nowadays, because of the diagnostic era that we are living in, not everyone who has gone through stent placement has had actually cardiac injury. तो cardiac event बहुत बार हुआ नहीं होता है. Because of certain investigations, a block was diagnosed. There was no cardiac injury, but the stent was placed because it was needed. So this also plays a very important role in deciding maybe this person, because there was no cardiac injury and stent was placed, he is better than a lot of us sitting in here. But someone who has had a cardiac injury and then a stent was placed, then a cardiac evaluation and maybe decision based on that should be taken. So this is something that we can look into.
Thank you. Thank you. We have
just
precisely
had,
5 minutes, sir. We have.
Yeah, I'll just add the icing to this. What our submission has been to the directorate, that the left ventricular ejection fraction should be 45% or more. There should be no regional wall motion abnormality, lipid profile normal, and various other parameters within normal limits. Thank you.
Thank you. We have 5 minutes precisely. And yes, ma'am, I saw you.
The major problem with the patients with a stent and a bypass surgery is we cannot forget the fact that they are mainly on the blood thinners. So if they have any episode of a fall or any such accident, I think the people on board or the captain or the master should be able to handle that emergency, and they should be aware of such a condition. I think that's one of the main hurdles that probably is in sending a patient with this on.
Ma'am, can I react to you as a former master mariner? I mean, I am a master mariner, but former ship's captain. I will ask the company, ऐसा भेजा क्यों मेरे सिर पे? घर पे रखो, मेरे जहाज पे क्यों भेजते हो? Yes, doctor, please. Is there a mic we can give?
While the mic is being passed on, yes, certain blood thinner categories are not permissible on board, but certain categories are. So again, this is one consideration before we consider fitness for sea service.
So sir, I'll speak about 2 points. First about the stenting part. So I specialize in internal medicine, right? I'm very new to this industry. And for me, look, you're absolutely correct. It should be an objective assessment, right? So ejection fraction is one part, but you should also do a TMT also. Because TMT gives you a functional assessment that whether he can prolong for that strenuous part or not. And when to do it, you can decide 3 months, 6 months on the clinical history, right? So rather than basing just on my perception, there has to be an objective criteria too upon which we build, right? For example, at present we also measure total cholesterol. We measure triglyceride. LDL is for what? Right? For me, I think LDL would be the single criteria most. I don't need a total cholesterol. क्या करूँगा मैं उसका? Triglyceride still can help, but triglyceride does not cause a cardiac event. It will cause a pancreatitis. Right? So there are many things that we have to evolve with time. Second part, I wanted to come that you said that you won't trust a captain to give an IV injection. Right? For that I have a solution. So we train a lot of doctors, not only doctors, but lay people with simulators, right? So these are simple IV arms. You also teach CPR to your masters, right? Why can't you teach them an IV? It's very cheap, not more than 70,000, easily available. You can teach them to give IV injections in case of emergency, right? Not as a routine. And this is something that we would like to, the DG to look into, whether to give the advanced training on such simulators which were not available previously.
Thank you,
Just to
Doctor.
address this, TMT is a part of the cardiovascular assessment, which I did not enumerate, but is being submitted to the directorate accordingly.
I want to thank you, Doctor. I can see already brains whirring here about the potential business opportunity that this course you are saying is going to generate. Some of them will be quickly Googling to find out इसमें कितना मिलेगा. So we have, yes, Mr. Vimalsan, I'll come to you. I must give doctor the preference. It's a doctor's conference. Yes, doctor, please.
Yeah, just to add to what Dr. Divakar sir started the conversation, I would totally agree. The table, sir, that you were referring to, the list of conditions which are not permitted on board the ship, they were there in the previous MS rules, basically.
Yeah.
And frankly, they were not very helpful because in medical science, it's rarely the case that a patient or a seafarer is presenting to you with a condition and things are absolutely black and white. Person A is fit and person B is fit. Whenever there is a condition or there is a disease present, you need to look further. You need to find out the severity of the disease. You need to look what kind of problems can happen on board the ship. You need to see the treatment that the patient is undergoing. You need to see his fitness levels currently, and then you come to a conclusion whether he can be given fitness or not. Now, all of these things are basically mentioned in the ILO IMO guidelines of 2013 that Dr. Divakar mentioned. The present draft, new draft MS Rules 2025 that we have, they again mention a brief list of conditions, and basically they say that a patient has to be evaluated. Probably in most of these cases, the decision will be unfit, but the final decision is, however, left to the doctor. But if we talk about medical examiners, the actual information, the actual medical knowledge, which helps us decide whether we are considering a crew member fit or not, we practically use on a day-to-day basis the ILO IMO guidelines of 2013, which have classified majority of conditions into 4 categories: unrestricted fitness, restricted fitness, a limitation to be placed on the fitness or not, and a permanent unfitness. And there are fixed criteria in each disease, category wise. So probably it would be useful it should be left to the doctor to evaluate correctly, to come to a conclusion and take a informed evidence-based decision. And second reference material would be the Appendix E in ILO IMO guidelines, which can be used, as a kind of a ready reckoner by all the medical examiners. He was also mentioning about vision. One more issue I would raise is, one was with regard to, need for spectacles and LASIK in pre-C candidates. One more issue is color vision, especially in food handlers, in ranks which are non-technical crew members, that is not deck side, not engine side. As per the current rules, even now, normal color vision is mandatory for them. But as such, for their job responsibilities, they don't need a normal color vision. And there are a lot of crew members, like food handlers, retail staff, with the cruise industry and everything. We get a lot of crew members who are not going to have any watch-keeping function, any technical job on board the ship. So for them to be denied fitness just on the basis of a partially abnormal or abnormal color vision does not make a lot of sense. Similarly, with regards to criteria for height, weight, BMI, there are minimum limits mentioned for BMI, height, weight. But sometimes you will come across a crew member, who is below the minimum weight or below the minimum height. And medically we are satisfied that there's nothing wrong with him, there's no illness. And this just seems to be a case of genetics. Constitutionally, he's been born with, a frame of body or a height which is slightly less than the normal limits. So in those scenarios also, it becomes very difficult for us to justify to the crew member why we are declaring him unfit, because the guidelines do not give us any leeway to, come to a informed decision.
So there is, just to interrupt you, regarding this height and weight, I think there is already a circular issued by DG Shipping because there was an appeal made by us in this regard. that, especially people who come from the mountain, hilly regions and hill tract areas, that their weight and height is, there is, I think, 2-inch grace given to them in height and correspondingly in the weight. So that has been taken care of.
Right. So that is there specifically for northeast and hilly states.
Hill tracts, yeah, let's leave it at that, yes.
Sometimes we will come across, people living in areas other than this also
अरे
where
बोल दो महाबलेश्वर में रहता है सर, क्या अभी कितना बालू काटोगे, जाने दो सर. It has generally been taken care. I mean, we will always have isolated cases, sir. ये तो होने वाला है. Unfortunately, they have to administer 500,000 seafarers. That's one. Then they have to also deal with argumentative people like me and Rajesh here. So it's not an easy job they have. We must accept that.
So one last point, with regards to the validity of the medical certificate, the guidelines basically mention, and international guidelines also mention, that maximum validity is 2 years.
2 years.
In case the age is less than 18, then the validity gets restricted to 1 year.
Yeah.
But medically speaking, we do come across situations and conditions where we as medical examiners, if we feel that the crew member needs more frequent follow-up, for example, if the crew member is on medications and he's been cleared for fitness, the medical examiner may decide that he should get only a 1-year validity, with the understanding and with the idea that after 1 year of service, he comes back for a fresh PEME so that we are able to re-evaluate. At certain times, we will pick up certain diseases, certain conditions in a crew member, where the specialist that has cleared the crew member, be it a cardiologist, a gastroenterologist, a nephrologist, presently they are satisfied with the health of the crew member, but they want to see a follow-up. They want to see the crew member again after 1 year. So in those scenarios also, we usually restrict the validity to 1 year. The case that we were discussing about angioplasty and CABG bypass or that being done, usually the guidelines say that the maximum validity again should be restricted to 6 months to 1 year. The idea being that, we have a regular follow-up of that crew member.
But just to interrupt, I think Dr. Shashank and Captain Mohan Naik here, because I have done this in the past, that in case there was some, what we called a dodgy, condition like this, that he was told that he has to come back and refer to a doctor. He had to go to a accepted doctor and get a fitness from that doctor and report back. So this was a practice I think decent companies or genuine companies did follow. It was common.
The point I was making was that there is no such, it's not documented in the draft MS Rules 2025.
Sir, mat karwao.
It is left to the discretion of the doctor.
लेने के देने पड़ जाएंगे. You give one more document to someone, we will be in a mess. As it is with the rules not yet come out, they are spending whole day with us here. So rule आने का बाद क्या होगा आप सोचो. So let us
just
Sir, actually it is covered, if I may tell you, with due respect, that it says maximum validity is 2 years. Maximum. So when we say maximum, there is also which can be less than that.
Yeah, sure.
So based on the medical conditions, if you think that increased surveillance is needed, you may restrict it to 1 year as well. There is no problem with that, isn't it, sir?
Yeah.
Additionally, in this context, we also get requests from some companies that for age more than 40 years or age more than 54 years, they would want the validity restricted to 1 year. Again, the idea being that the older a patient, crew member is getting, a frequent follow-up should be.
I'll interrupt you here. Isn't the company paying for the medical? Yes. They have a right to ask you to limit it. Why not? If I pay for it, I'll say I want it maximum 6 months. Nothing wrong. If the seafarer wants, he can join. If not, up to him, because he is not paying for it. If the seafarer is paying, then be very careful. But if the company is paying, I don't see.
Yeah, so,
Yeah?
sorry, so there is a, here.
Yeah, sure.
So, and this is again based on the experience which we have seen, over the years. Most of the companies, 40 plus, the validity is only 1 year. Because we felt that, after 40, especially in senior ranks, the stress level, the, kind of engagement activities are far more, and they needs to be, checked on annual basis. So this has been, and we have seen it in other countries also. So it is a very common case.
We really need to, it's already showing 000 and we are, it's 10 minutes ago it became 0. Okay. We have one last, and Mr. Bimalsan, it has to be a question, huh? Please. Thank you.
Can I go? So can I go ahead?
Question, please.
So, sorry for interruption. I brought 14 kg of stuff over here. I couldn't hand over to you. I have to take it back with the plane. Can I ask some question associated, related with the seafarers?
Medical issue.
Medical issue. Not a खाना पकाने का नहीं, but medical issue.
Never medical seminar.
So, some of the company, they are making their insurance policy priority to top 4. वो जाट में रहने के टाइम पे इंश्योरेंस पॉलिसी है, come down to home also insurance policy cover. Why not for the others? What is the difference? The company, like, he want a top 4 immediately for the longer time. That's why you are using the insurance policy for the top 4 remaining to Renado or Marna. Who is suffering?
Okay, let me understand your question. You are saying that a company is providing health insurance to the top 4, that is master, mate, chief engineer, second engineer, while they are on leave.
Yes.
And why nobody else?
Yes.
That's for the company to decide. They are paying for it. The MLC and our DG's rules, RBS rules are very clear about providing medical benefits to seafarers while they engaged on board. They are very, very clear, and there is no dispute in that. This is a facility which some companies may give everybody. Sir, आप बोल रहे हैं top 4. I know companies who provide top to bottom everybody. That also I know.
Yes. Yes.
So some don't. पैसा नहीं है उसके पास, नहीं किया. I'm just answering for them. Please answer. If you have money, please do it.
Absolutely. So as rightly mentioned, it is purely based on the principal ship owners. If they are willing to pay, we are very happy to pass it on to seafarers. There are companies who are giving top to bottom medical health insurance and their families round the year. But there are companies who don't pay. So it is very clear, and it has been told to seafarer.
I think if there is any grievance in this regard, the gentlemen are sitting here, the table is there. There is a DG shipping grievance portal. The seafarer can go to or his family can go to the DG shipping and complain that I am not being properly treated. I mean, there is a way up. Would you subscribe to that, gentlemen? Would you?
Yeah, absolutely. So
Nobody. Okay.
it also depends on which part of India he is from, or what kind of illness he is suffering or he signed off on. So there are various aspects. There is no discrimination as such, rank wise, but it is purely case to case basis.
Can you do it at the seafarer choice? There is a P&A clause is there. If the seafarer choice for the Taj Mahal or whatever Irani hotel, that is choice is there. Is there. Anyway, last and final. See that you are selecting the crew for the gas carrier, chemical tankers. It is specially effect of the seafarer body. This is this thing. When you are asking for the medical before joining the ship, especially on gas carrier and chemical tanker, when I count down sign off, it has to be pre-medical for the after the sign off.
It is already there in the RPS rules.
None of
it's
them
already there.
No, none of them doing, sir. That's why I am bringing your knowledge.
Thank you, but it's already there in the RPS rule.
None of them doing so. Can you give me any kind of this thing?
So I think you are referring to chemical screening.
Yeah,
so when they
blood accumulation test.
Correct.
That's
exactly.
Yeah, BSc.
So based on the vessel they have served, and if the vessel
the
is
cargo
carrying,
they have carried.
Yes, exactly. The cargo they have carried. So once they sign off, there is a chemical screening which happens, and I think it is mentioned already.
Quite common.
Sir, you mentioned, so none of seafarers got a pre-medical after the sign
Yeah,
off. This is for
exactly.
your knowledge. Thank you very much.
Yeah. Right. Thank you. Thank you. हाँ सर RPS rules में है already blood.
सर रूल्स में है तो इम्प्लीमेंट नहीं हुआ सर.
Okay. I think we have overshot by half an hour already, so we need to wind up. And I must thank you very much for the panel. And as you can see, this entire business is a commercial business. And when you want to regulate commerce, it's not easy to regulate commerce because somebody gets pained. So thank you very much, sirs. It was nice, and thank you for being a nice audience. Thank you. This is my.
Thank you to all the panelists for this wonderful discussion. I invite on stage Dr. Kanwar. Are you there here? So please join us on stage to felicitate our panelists and moderators. Yes, Dr. Vijay Belani.
It's an honor to receive this plaque from you.
Dr. Divakar Tiwari. Dr. Kiran Pandit. Captain Dr. Shashank Jahagirdar. Captain Mohan Naik. Captain Nitin Mukesh. And our moderator, Captain S.M. Halbe. Thank you for adding your flavor to the panel discussion. I would invite all of you to join us for a group photo.